Hello, Kate. My name's Andrew.
Hi,
I'm
nice
going
to
to be
meet
taking
you.
care of you today, okay?
Hi.
All right. So, what brings you in today?
So I've noticed that in the middle of the night I wake up and I'm just kind of gasping for air.
Okay. And about how long ago do you think that started?
It kind of started 3 weeks ago. I've had some issues. It doesn't happen every single night, all night,
Mhm.
but I've noticed and my partner has noticed as well. So we kind of figured I might as well come in and see what's going on.
Okay. So, not every night, just occasionally. You would
Most
definitely
nights a
say
week,
most
yeah.
nights. Okay.
Most nights.
All right. And is there anything that was happening when you kind of noticed this about like 3 weeks ago?
No, nothing really different happened except for that I woke up gasping for air.
Right.
I do snore really loud at night.
Okay.
So that used to be the main issue, but now this is kind of
Snoring.
the added issue that
Right.
wake up like this, so it kind of scared me.
hmm Okay. But you didn't. Nothing happened prior to bed that night. Okay.
No, nothing new.
All right. Does anything make it better? Anything you've tried that helps?
I try to sleep on my side instead of on my back.
And that does help a little bit?
A bit,
Okay.
yeah, but I always roll back to my back.
Right. Subconsciously.
Yeah.
Understood. All right. And then anything that's making it worse?
Definitely just sleeping straight on my back. If I
Back.
put a pillow even under me, sometimes that'll help a little, but sleeping on my back definitely makes it worse.
Right. You haven't noticed anything else? Gotcha.
Mm-mm.
All right. So since that started 3 weeks ago, did you notice that maybe it was starting 1 or 2 nights and now it's gotten worse? Has it resided a little bit?
No, it's been about the same. It
The same.
happens every few nights, a few times, and not really worse. Not that it's happening every night yet,
Okay.
but I don't want it to.
Right. I hear you. So just recapping a little bit, you said this has been going on for 3 weeks, kind of most nights a week. It does help when you sleep on your side.
Yeah.
Like you said, you kind of roll back on your back and it gets worse.
Yeah.
And that definitely always makes it worse for you. Has it changed since it started?
Mm-mm.
And have you ever had this issue where you're waking up gasping years prior, months prior?
Never waking up gasping. Sometimes snoring. I would wake
The
myself up
snoring.
snoring so loud. It's embarrassing.
Right.
But yeah, or I'd keep my partner up snoring.
Mm-hmm.
But the gasping is a whole new symptom.
Understood. Understood. When you happen to wake up, gasping and everything like that, does it vary at all? One time it might be a 1 out of 10, 1 being the easiest, and sometimes it might be a 9 out of 10, 10 being the worst.
It's usually always about the same. I guess I would rate it as like a 5.
A
Like
5.
it's I wake up, I
Mhm.
gasp, I catch my breath, and then I'm usually pretty startled. And then once I'm
Okay.
calmed down, I fall back asleep.
Okay. Thanks for telling me that. It definitely helps. Does it happen at a certain point in the night, early in the night, late in the night? Could be any of
It's kind of
the above.
any time,
Okay.
yeah. I guess more times later in the night than versus when I just fall asleep. But
And I do want to ask you just a couple of questions about your snoring. When did that start?
it's been a few years,
Few
probably
years?
5 years, yeah.
5 years. And you didn't have anything happen. I mean, it could be surgery that kind of changed things, and then you started snoring.
No, I just kind of started snoring. I know my dad gets this as well.
And no one else that you know, just your dad. You're thinking.
Just my dad, yeah.
Okay.
My mom doesn't get it.
Okay. And the snoring, had you tried any over the counter stuff, prescription medication to help it? Anything make it worse, better?
I've tried like those nose things and
Mhm.
all, but
The
those
nose
never
strips.
really helped. I know I've read online that it can be something like going on my throat, like I guess fat, or my throat is closing. I'm not really
Mhm.
sure. So I think that may be more of the issue since the nose things don't help. I'm
Yeah.
not really
You still
sure.
experience it with those.
Yeah.
Understood. Um, so I do want to ask you a couple questions. I know that you've been waking up and stuff regarding your throat because it seems like there might be an issue going on there.
Mhm.
Do you have any conditions with your teeth or gums?
Not that I know of, no.
Okay. And no bleeding,
No.
right, from the gums? Okay. Do you use dentures, have dentures?
No.
Okay. When was your last dental exam?
6 months ago.
6 months.
I try to go twice a year. I'm pretty good
That's
about
awesome.
that.
I'm glad to hear that. And your tongue feeling sore or anything like that?
No.
Dry mouth, frequent sore throats?
Sometimes, I think I just get a dry mouth or sore throat from like, probably the lack of breathing and stuff at night,
Right.
but nothing crazy or constant.
And have you noticed like a hoarseness to your voice? Any changes with that?
No.
Something more raspy? Okay. That's good to hear. Do you get frequent colds? Any stuffiness?
Nothing more than I think your typical once or twice a year change of seasons, cold or allergies.
Okay. Stuffiness. And have you noticed with this issue anything going on with nasal discharge, mucus, and when you're sneezing?
Not particularly, no.
Okay. Itching of the nose?
No.
Okay. No hay fever? You said no nosebleeds? Any other sinus troubles? Anything?
Mm-hmm.
Okay. And regarding your neck, swollen glands? Have you felt anything like that?
No, I don't think I've ever felt that.
Okay, that's good to know. A goiter can kind of be another lump. Have you noticed anything around this area?
No, not
No?
that I've noticed.
Okay. And no, like just
Could happen.
pain or stiffness? Anything in general?
No.
No? Okay. That's good to hear. I like it. So with your breathing, I'm just going to ask you a couple questions with
Yeah.
this. There always could be a relation. Any excess coughing during the
No.
day, normal hours? Okay.
No.
Any mucus, sputum,
Not really, no.
shortness of breath, wheezing?
Just when I wake up in the middle of the night.
Just at night. Absolutely. And then when you take a really deep breath, any pain?
No.
Okay. And any history of asthma?
I do have asthma.
You do have asthma.
Mm-hmm.
Bronchitis? Ever been diagnosed with that recently?
No.
No? Okay.
As a kid once.
As a kid. Emphysema, pneumonia, tuberculosis?
No.
None of those. Okay. Awesome. All right. And so related to this, is there anything, socially that you do, any behaviors that might have contributed to it, like smoking?
I don't smoke, no.
Okay.
Nothing else I can really think of behavior-wise. I know that I'm just really tired during the day, though.
Really
While like, I'm
tired
just
during the
not
day?
getting good sleep. I can almost just fall asleep all day, like throughout class and everything.
Okay. And did that start around the 3 weeks ago?
It's
period?
gotten worse for sure.
Okay. Gotten worse over
The
3
past
weeks?
3 weeks,
3
yeah.
weeks.
I would say definitely the past 3 weeks it's been the worst.
Okay. And with the falling asleep, does anything help make it worse, better?
I just try to drink caffeine and keep
Okay.
going, yeah.
Caffeine helps it. It's good to know.
Can't really just stop.
Yeah. Has that happened before? You falling asleep, during the day?
Yeah, I will start to, but I usually catch myself. I'm a teacher, so you can't really fall asleep as you're teaching,
Right.
but maybe when the kids are taking tests, I'll notice myself almost nodding, but
Mhm.
I have to be really attentive with them.
Absolutely. So excluding the, gassing of breath when we go, focusing a bit more on that fatigue, falling asleep,
Yeah.
has ever happened before? Even more than a decade prior.
I would say since I noticed how badly I've been snoring, I would have, some weeks or days that would be worse. But I think since it's been getting worse the past month, 3 weeks,
Mhm.
I definitely am having a lot harder of time sitting up.
Okay. Understood. All right. So now I want to move on, just, medications, allergies, that sort of thing. Do you know of any allergies, even seasonal?
Yeah, I'm allergic to peanuts.
Okay.
I get my throat will just completely close if I take those or eat those. And I'm allergic to amoxicillin.
Mhm.
I had that when I was younger. I just got a rash.
Okay. Do you know how old you were?
I was like 5.
Going back to the peanuts, when did you last experience that?
I was
Any idea?
super young. It must have been around the same age, like 5, when my parents first exposed it to me. Maybe a little younger, 3 or 4.
Okay.
But it was a
Since
no-go right
then,
away.
you successfully avoided that.
Yeah.
Okay. Very good to hear. All right. For medications, do you take anything? Prescription?
I have an inhaler I take.
Okay.
It's the Advair Discus.
Awesome.
I know on it says 250/50, but I don't really know what that means. It's just
Thank you
big.
for that.
Yeah.
All right. And then any, over-the-counter stuff, Advil, Tylenol.
Sometimes I
vitamins.
take Advil if I need to. I take B12
Okay.
every day.
All right. So So now going back to your childhood, just briefly tell me, was it a pleasant childhood?
Yeah, I
Comment
would
on
say
it a
it's a
little bit.
pleasant childhood. I grew up with my mom and dad. My
Mhm.
grandparents lived just a few roads down, so that
Mhm.
was nice. That was my mom's parents. So it's really nice to just have grandparents always around. And
Mhm.
I have an older brother. I would say it's pretty pleasant. I wouldn't have any complaints really.
Very nice. Very nice to hear. And in terms of childhood illnesses, did you happen to have anything? Anything come to mind?
Besides the asthma, nothing really. No, I was never really a super sick child. I was always lucky in those terms.
Good. So no, would you say measles, mumps? What about the chicken pox?
Nope, never
No.
had that.
Okay. Rheumatic fever, scarlet fever, polio?
Nope.
Okay. No psych conditions when you were a child?
No.
Anything new? Okay.
Thank goodness.
Asthma's not a bad bargain.
No.
Only did that. In terms of your immunizations, do we have a record?
I did
You
give
know?
a record to the ladies up front.
Okay.
But I am up to date. They make me stay pretty up to date,
Okay.
being a teacher and all.
Yeah, absolutely. I'm glad we have those forms, though.
Yeah.
Definitely check that out. Moving to kind of your more relevant, medical history. Any issues with your thyroid, heart?
Not that I know of with thyroid. Sometimes I wonder because I've just been gaining so much weight.
Okay.
I'm wondering, like, I hear that if you have a thyroid issue, you can gain a lot of weight.
Mm-hmm.
But besides that, not that I know of.
Okay. Definitely going to come back to that in a second.
Yeah.
No heart disease that you're aware of?
No.
Okay. High blood pressure?
Nope.
Okay. Cholesterol?
No.
Okay.
Not that I know of.
Diabetes?
Nope.
COPD?
No.
Okay.
Just the asthma.
We got the asthma going on. Any history of cancer?
No.
That you're aware of? Okay. HIV, hepatitis?
No.
Kidney disease or blood clots?
No.
No? Okay, good to hear. And I know we said no psychiatric disorders for child. You don't have anything that's popped up recently psychiatric-wise?
No.
No immunizations. We're good on that. All right. So now, just want to summarize a bit. You were saying that you had a pleasant childhood. I'm really happy to hear about
Yeah.
that. No childhood illnesses, conditions except for the asthma.
Mhm.
Immunizations, it definitely sounds like we're on top of those, both childhood and more adult illness-wise. Asthma's a thing. Other than that, I'm not seeing too much. So I did want to kind of revert back. You mentioned weight gain.
Yeah.
When did that start?
Probably in the last 2 years.
2 years? Okay.
Yeah.
Kind of consistently through the 2 years?
Yeah.
Or has it gotten worse recently?
I wouldn't say worse recently. I just can't seem to lose weight, and I kind of just seem to gain it slowly.
Any changes to your eating habits? What you eat?
I've recently started being more vegan,
Okay.
just to try to see if that would help. That's why I take the B12.
Has that helped you?
Well, I know the B12 can help you be more energetic. That hasn't really helped, but I heard I was supposed to take B12 if I don't eat animal products, so I did.
Okay. You haven't noticed necessarily getting worse or better?
No.
And I know you said this has been going on for several years for
Yeah.
sure. Has it ever happened prior to that? Where
No.
you were kind of fine before this and then
Yeah.
has it
I was
happened?
maintained, and now it just seems can't get under.
Understood. All right. How many pounds would you say you've kind of been gaining
I would say in the last year, maybe I gained another 5.
in the last year? Okay. All right.
I
Thank
know it
you for-
wasn't crazy, but
yeah.
you don't want to gain it.
Yeah, yeah. Hey, if you're monitoring it, that's all we ask for.
Yeah.
For the asthma, I know that you do have that inhaler you referenced. Do you have any issues with that? Using the inhaler, it
No,
working with asthma? Nothing?
no, it works just well.
It helps. Okay, good. And any recent accidents or injuries?
Not recently,
Anything?
no.
And recent hospitalizations? Have you been in the hospital recently at all?
No, not recently. When I was young, I was in the hospital once. That was the only time.
Okay. How old do you think you are?
I was 7. I
7?
broke my arm and they had to do surgery, so I had to stay the night.
I hear you. Do you know what hospital this was?
Yeah, I'm from Scranton, so it was in Scranton.
Okay. And did they give you a cast? And that
Yeah,
helped you out? Okay.
for most of the summer.
I'm sorry to hear that. They're never fun. Cast. And since then, any issues with the arm? No complications from that?
Nope, it's been working fine.
Awesome. That's what we like to hear. And any other surgeries? Or any surgeries at all, I should say?
Nope, that's it.
Okay, good. All right. So I'm just curious if, you're keeping up with a lot of things, it sounds like.
Yeah.
I want to make sure, you're keeping up with other things in regards to like a mammogram. Are you doing that once a year?
No, they said not until I'm like, I think it was 45 or 50.
Awesome. Thanks for staying on top of that. Colonoscopy, probably the same thing?
Yeah. Not yet.
Pap smears?
Yeah, I get that once a year when I go to my gynecology appointment.
Awesome. And have you recently gotten like a TB check, the skin check?
Yeah, they make me do that yearly actually.
Good. And it's never came back?
Nope, always been good.
Good. Cholesterol, I know you said you don't have any issues with that. Are you going for those checks too?
When I go to the doctor, if they check it, yeah.
Okay.
But I've never done it like intentionally, I guess.
Okay.
Yeah.
Have you ever had like a stool test
No.
recently? No. And then any screenings with the lungs? Have
No.
you been to like pulmonologist, any chest X-rays, anything like that?
No, the asthma's been pretty controlled that I know of, so I've never been
Good.
told to go to anything like that.
Good. All right. So I'm going to shift over just some women's health here.
Okay.
How are your menstrual cycles? Normal? Any issues? Anything you want to let me know about?
Nope, they're good. I get them once a month. I'm on birth control, so they're pretty regular.
Awesome.
Or they are regular, I
Mhm.
should say. They last about 5 days, and that's it.
Okay. And by regular, you mean, are you talking about flow?
Yeah, they're not excessively heavy or anything.
Awesome. And about when did your first menstrual cycle start? How old were you?
I was 12.
12. All right. And regarding the pap smear, I know you mentioned you do keep up with that. Do you have any idea when your last one was?
I think I went last July, so just a few months ago.
Okay. Have you ever missed your period?
No.
No.
Thank goodness.
And no singular abnormal menstrual cycles?
No.
No. Very good to hear. The past smears have always been fine?
Yes.
Anything I need to know? Okay. And any history of sexually transmitted infections?
No.
No. Do you mind if I ask you about any possible pregnancies?
No, that's okay.
Is there anything you're aware of that, failed, successful? Do you have any kids?
No kids, and I've never been pregnant.
Okay.
I've tried to be pregnant, anything like that.
Okay.
Waiting.
Absolutely. Thank you for letting me ask you about that.
Of course.
And are you using any anti-contraceptive methods?
I just use the birth control pill.
Okay. Are you sexually active?
I am.
And are you in a relationship?
Yes.
Would your partner describe him or herself as male, female?
Male.
Male. And would you guys say, in terms of anti-contraceptive methods, are you using condoms at all?
No, not anymore. We both have been tested. We've been together for quite a while now, so we just use the birth control and we just make sure that we get our yearly checkups with screenings and all.
Absolutely. I'm very happy to hear that you're keeping up with the screenings. That's awesome.
Mhm.
I would say keep up with them, and just know condoms are the only thing that does prevent sexually transmitted infections. It's always just good for patients to be aware of that. But I'm glad you're getting a screen and everything.
Yeah, thank you.
Mm-hmm. Do either of you have multiple partners?
No.
No.
At least I hope not.
I would
You
hope so too.
shouldn't.
Absolutely.
Maybe I should double check.
Alrighty. So now a big switch. I do want to talk a little bit about your family.
Okay.
Do you have any family history of any illnesses or disorders that, on the top of your head?
My mom has high blood pressure and diabetes.
Mm-hmm.
And then my dad, he has sleep apnea, I think they call it.
Mm-hmm.
Yeah.
Okay. Just 1 second. Is he being treated for the sleep apnea?
Yeah, he wears some device at night. Kind of nervous that I'm going to be told I have that.
We will get to the bottom of it. Don't worry.
I don't want to wear that.
Any family history of headaches, seizure disorder?
No, not that I know of.
Okay. What about stroke or mental illness?
No, not that I know of.
Any suicidal ideation in
No.
the family? Substance abuse, thyroid disease,
No and no.
coronary artery disease, any other issues?
Nope.
Asthma. I know you mentioned you did.
I have asthma, and my dad has asthma.
Your dad. Tuberculosis in the family at
No.
all? Kidney disease?
No.
No arthritis or cancer? Anything here?
Mm-mm.
What about allergies? Your parents?
I don't think so. They may have some seasonal allergies, but nothing else that I know of.
And you did say you don't know of any genetically transmitted diseases, infections, predispositions?
Nothing I know of.
Okay.
No.
So I have negatives for all those. However, just to cap or summarize, your mom did have high blood pressure,
Mm-hmm.
and then your dad, you did mention diabetes, asthma, and sleep apnea.
Yeah.
Okay. Nothing else ringing a bell?
Nope.
All right. And were you born in Scranton?
Yes.
We talked about that. Your parents and your father. You mentioned you were a school teacher.
Yes.
Okay. For what grade? What type of school?
4th grade.
Fourth grade.
Elementary. Yeah.
Do you enjoy it?
Yeah, I do. Yeah,
Okay.
they're cute.
Have you been doing it for a long time?
Yeah, about 5 years.
Okay. What about prior to that?
I was in college.
Okay. Did you graduate from college?
Yes, I did.
And I know it might be a little bit early. What are your perceptions on retirement?
I have a fund I have through my job. We put
Okay.
some away every month out of my paycheck. And besides that, I'm just trying to save up in those terms,
Okay.
invest when I can. Trying to pay off my loans first.
Mhm. They are a tough thing.
Yeah.
And then tell me a little bit about your home situation.
So I live with my boyfriend,
Mhm.
the one that we've been together for a while, and it's just us and our dog,
Oh, what kind of dog do you have?
the lab, a black lab.
Do you have any sources of stress in your life?
Not too much. I mean, I would say I'm pretty happy. Of course, school, or not school, but work, I always call it school, can be a little stressful at times. You know, kids can be challenging, making sure you're doing everything right. Financially, I'm pretty okay, so
That's good to
I
hear.
try to keep my stress pretty low. I
Mhm.
work really hard at that, so.
Absolutely. Thank you for being honest with me with
Of
that.
course.
I do want to ask you though, have you ever been disrespected, hurt emotionally? at home?
No.
Okay.
Thankfully, my boyfriend's really good. So
That's
is all my
awesome.
family, and we're.
It's awesome to hear. Outside of the home, anyone that you might think of?
No.
No? Okay.
Mm-mm.
Absolutely. Have you ever been in the military?
No.
Financially, you did say everything's okay?
Yeah, everything's pretty good. I mean, as good as I think it could be.
Good to hear. And what do you do for you? Tell me a little bit about, what you enjoy
Yeah.
in your day-to-day life.
I try to work out every day after school.
Mhm.
Usually yoga. As much as I can. It's kind of hard sometimes. You're just so tired.
Mhm.
So that's definitely gone down a bit lately, just with how tired I've been.
Right.
But I do that. Spend time with family and friends,
Mhm.
and just kind of relax when I can. Have fun. Go hiking. I like to spend my time outdoors or go traveling, stuff like
Mhm.
that.
Awesome. Sounds like a lot of fun.
Yeah, when I can have it.
Yeah, get us when you can. And I know you mentioned the fatigue and tiredness, lack of sleep.
Mhm.
Excuse me, does that ever affect, any of your daily activities, going to the bathroom, anything to know like that?
No.
Okay.
Mm-mm.
I'm glad it's not that serious.
Yeah, yeah, me too.
And then tell me a little bit about your diet.
So I told you I just recently have started been going more vegan.
Mhm.
That's been like a slower progression. I stopped eating meat for a while now, like maybe 2 years.
Oh,
And I've just been slowly transitioning throughout
Mhm.
to really no animal products. Sometimes I eat dairy, but that's why I started taking the B12, because I was told that really if you're not eating that much animal product, you should have it.
Mhm.
So I would say I try to eat pretty healthy.
Good.
I consider it healthy.
Absolutely. And what about caffeine intake? Do you drink coffee?
Yeah, especially lately with how tired I've been, maybe like 2 to 3 cups a day.
Okay. Would you say every day? Does that spare the weekends?
Yeah, every day.
Okay.
Even though I probably don't always eat on the weekends, it just tastes good.
Absolutely. So I know we talked a lot about your sleep habits.
Mhm.
I'm just curious, do you?
Yeah.